So hi everybody. I'll just start through some of my slides and give me a yell if you have any questions along the way, and there'll be time at the end as well for questions. Is that better with or without? So I've been asked to talk about the local supports, and we are pretty lucky that we have quite a few local supports. So hopefully at the end you'll have a better understanding of some of the different things that are on offer. And I can't go into a lot of detail about each of them, but you can always talk to one of your McGrath breast care nurses and we can link you in with those services. Hang on. I clicked next, but it didn't do anything. Oh, that one? Okay.
Oh, it's just stuck on.
Cool.
There we go.
Thank you.
Sorry.
Oh, okay. Alrighty. So I think we've already had that beautiful welcome to country this morning, which was fabulous. And so just a quick why we're here for this service. So Jane McGrath founded this service because she went through her first breast cancer treatment with no breast care nurse, and when cancer came back and she did have a breast cancer nurse, she realised what a difference it made. So Jane and Glenn set this whole program up, which is fantastic. So our aim is to make life a little bit easier for the families and people experiencing breast cancer. And so McGrath actually raised funds to put McGrath nurses, hopefully, in every place that's needed, but we're needed in lots more places yet. And my position's actually funded by Drive for July. So if anybody still wants to sign up for Drive for July, that's the sort of thing that it's actually going towards. So that's just a quick snapshot of all the different McGrath nurses that are here at the moment. And you can see that we've got about 21 in WA, right all the way up to Broome, and quite a few in Perth, and we cover the southwest. So in the southwest, we've got 2 FTEs or full-time equivalents, and we spread that amongst 3 of us. So you'll see the first picture is our lovely Krina, who couldn't be here today. She works 4 days a week, and I'm 3 days a week, and our other breast care nurse has left. And so starting this week, we have Yana, who was our beautiful breast care nurse for 7 years and had a little break, and she's started back again. So if you're not already linked with one of us, you can actually self-refer. You don't need to wait for anybody else to do a referral for you. You can just give us a call, and I've got some of my cards out at the sign-in desk, or you can come up to me and I'll jot down your name. So our aim is to be like that central contact person through your cancer experience, and to provide you with up-to-date information. We use a lot of the beautiful resources from BCNA, like the My Journey and all the wonderful flyers. And there's lots of other good ones from Cancer Council as well, so we try and provide up-to-date resources, and that's where the My Journey Online is so good, because it can be updated so quickly, whereas a paper resource can't. And even just like during COVID, when everything was changing all the time and people had all those questions about how does this affect me, BCNA could do updates and get them in that online forum, and you had it straight away rather than waiting for, you know, a new production to be made in years' time. You could get that current information straight away. So trying to link you in with those sorts of things is what we are aiming to do, as well as practical and emotional support. I was driving home last night from the wonderful health professionals dinner, and I was just having this analogy in my head. I live down near Donnybrook Way, and it's quite a long drive at night when it was dark, and then all of a sudden I could flick on the high beams and I could totally see where I was going. And I guess that's what I aim as a breast care nurse. If I can light up the path and make it more clear about what should be happening now, or what you might be experiencing, or link you in with different services, then that's going to make that journey home so much better. So sometimes in that car, not only the high beam, but you might have the lymphedema therapist, or you might have cancer counsel or somebody else in that car with you, so that you're not in that car on your own, and you'll get home nice and safely. So we do do a lot of referrals to link you in with other services. The thing is that if this is a new experience for you, you don't know that those things are out there unless somebody can point you in the right direction and let you know about what those services are. So we're aiming to link you in with those things. So just to let you know a bit more about the local treatment options. So as far as surgery goes, we have private healthcare at St John's in Bunbury. We also have public care for surgery at Bunbury Regional Hospital, and then we also have Busselton Hospital. And our local breast surgeon actually does operations in all of those areas, so that's really good. And pretty much most surgeries that need to be done for breast cancer can actually happen down here. But when it comes to reconstruction using your own tissue, for that type of surgery you need a plastic surgeon as well as your breast surgeon, and so that would actually, you would be referred up to Perth for that sort of surgery. With chemotherapy, both public and private patients have care at our Comprehensive Cancer Centre, which is in at St John's on the first floor, which is where our rooms are as well. And just to let you know as well that there is a service called Chemo in the Home. The medical oncologists that we have down here in Bunbury aren't linked in with that, but a couple of the medical oncologists up in Perth will refer through to Chemo in the Home. It's particularly good for things like Herceptin, where you're having that every 3 weeks, and somebody can actually come to your home and deliver that chemo for you. It's a fairly new service, that one, but a good service. Radiation can happen at Genesis Care, and that's also on our same health campus, and because radiation is usually Monday to Friday for a number of weeks, depending on what is required. For people who are out of town at more than 70 k's, they can get access to PATS, and they can actually stay in the accommodation here in Bunbury for the period of their treatment. And the people at Genesis are really good with trying to arrange that. If you were coming from the country, you could have an afternoon appointment on the Monday, so that you could have been home over the weekend, come have your treatment, stay Monday, Tuesday, Wednesday, Thursday, have an early appointment and then get home. So at least you'll be home for some of the week. We also have breast screen on the same health campus, and they do the breast screening, but we also have an assessment centre, so that runs every second Friday, and so any assessment that needs to be done can happen here locally as well. Other supports that we've got in the southwest and that we utilise a lot, we've got Cancer Council at Dot's Place. They have lots of different things on offer. Things like financial support, counselling, they've got their wig library, they have their Life Now classes, which is a 12-week program to get people back into their exercise and give them that confidence to keep going with that. They also have like Tai Chi and yoga, all sorts of things that happen there. And in Bunbury we've got Kate, and in Busselton there's also a Cancer Council, and that's the lovely Betsy over there. And then we've already mentioned Breast Cancer Care WA, who are fantastic, and they also have counselling, both face-to-face as well as over the phone. So sometimes you don't want to go to yet another appointment outside of the home and you'd like to just stay in your comfy pyjamas and you can do your counselling over the phone. So that's really good. They also have financial support available, and we have Mel Rowley, who's the metastatic breast cancer nurse as well. So she's got that particular expertise that we don't actually have down here. So that's a good person to be linked with as well. And also they run our support groups. So once a month, we've got the lovely Katie doing the support groups. So we've got the early breast cancer support group and the metastatic breast cancer support group. And I know that those of you who go to those groups get a lot of good value out of those and made some good friendships too. So that's fabulous. Mentioned about BCNA and all the information, but also the My Care Kit is a really valuable thing. So when we get somebody is referred to our service, then we fit them for their bra, their soft form if they need it, and we also let them know where else that they can go to get further bra and prosthesis and things like that. And then we've got those online groups and the Beacon newsletter, which I love to read each time as well because they're full of such inspirational stories. So as far as bra and prosthesis fitters, so we have La Femme at the Plaza in Bunbury, and in Busselton we have Fig Tree Lane, and then we've got Cecilia with Papillon, who again, she'll come to your home, which is fantastic. Again, another time you don't actually have to go to yet another appointment, and you can have that personalised service at home. And there's also Easy Fit mobile fitters. So we actually, in our initial packs that we give people, we have all the contact details for all these different supports that I'm mentioning. And I can take somebody's name down if anybody doesn't have one and would like one, and I can get that to you. With our complementary therapies, we have Solaris Care in Britton Road, so just down from Kmart on that road there. And they have all sorts of wonderful therapies. Those therapies are really handy at any time during your treatment. I find that some of them can really de-escalate your stress, and when that stress is lower, then you can actually see your way forward. They have things like sound healing and Bowen therapy, even hand and foot massage, lots of lovely things that often we know would be good for us, but we don't take time out to do it. So, and it can be costly as well. So this is free service. People donate their time and their expertise, and anybody can access those. Cancer Council WA, they also have some different therapies like the Tai Chi classes that they do, and they also have yoga classes, which are a really great way to dip your toe in and see if that might be something that you'd like to do as part of your ongoing way of doing your exercise. In Manji, they have the Rose Centre, which is also a bit like Solaris. And the other thing with these lovely therapies, people donate their time to do those therapies, and I think they're so valuable, but if people don't use them, those things will drop off. So I really encourage everybody to, you know, if that's something that you've never had a Bowen therapy before, or you've never had a Reiki, and you think, oh, maybe I'll see if this is something that will help me, it's a great way to do that for free and see if that might be a therapy that would be beneficial for you. Allied Health Services in the southwest. So through WACS, the WA Country Health Service, we've got the Integrative Cancer Services. This has only started in the last couple of years when a great big study was done, and they highlighted some of the areas that we needed more help down here. So we actually have a lymphedema therapist, Peter, who can do some testing. In an ideal world, it would, as Peter said, it would be pre-surgery, but at least getting that done post-surgery is good. They also have a special education class once a month that's held at Cancer Council, but it's run by the Integrative Cancer Services, and that's called Keeping Abreast of Lymphedema. So that's just a one-off session that people can go to, where they will give a little bit more detail about what lymphedema is and what you can do about it. And they have both Peter and Ali, the physio, give a talk. So that's an education that we try and encourage everybody who's having any surgery to actually attend. So it's run once a month. And through that service, we can also access some time for social work, physio, and I think dietitian as well. And then through St John's in Bunbury, if people are using the chemo unit there, they can also have access to the social worker and the dietitian there too. And then we have our independent lymphedema therapists, of which Pia is one of the couple that we particularly recommend. We have a big list of the different lymphedema therapists, and trying to find somebody that's near you. So we've got a couple. There's one lady who goes to Cowarumup and Margaret River. We've got a couple in Bustleton area. Then we have Pia here in Bunbury. We have Robin in Australind, and so that's really great now that we have that expertise down here. Sometimes when you go to somebody privately, the cost can add up a little bit, and that's where seeing your GP and getting something like a GP management plan, which can give you access to 5 visits of subsidised cost. That can offset some of the costs that are involved. Also, if you have any health insurance, that might be able to offset some of those costs as well. And then we have the exercise physio. So we have Andrew, and I always get muddled up which one Andrew's at. Is it Maximum Results? Oh, have we got in? Yeah, exercise physio.
I believe he's no longer there.
Oh.
We used to have an excellent one who was
Yeah.
actually oncology trained.
Yeah. So we don't have him anymore.
I might be wrong.
Okay, I'll give them a call and find out.
They've had a massive rigmarole of staff at Maximum Results. So
Okay.
I actually can't really use there anymore.
Alrighty. Well, we've got the pink program anyway, so there we go.
Just go to that.
Yep. Okay. So I've mentioned about the support groups. I didn't mention that I flicked that slide. Oh, hang on. There is a support group as well in Bustleton, Dunsborough, and a Collie General Cancer Support Group, and Manjimup have one as well. So it's worth looking into your local area if they have a support group. Other supports that we've got is the Dragon Boats, which the girls are over there if you want to ask them about it. We also have the Encore program, which is an 8-week exercise program, which is only just finished in Bustleton just now, and it runs once a year. Hopefully we'll get one in Bunbury again soon. And then we also have the Look Good, Feel Better. Otis Foundation have cancer retreats and Reclaim Your Curves. I'm going to be running out of time, so I'll whip through this. Just where I see the growth of the service would be more time or another McGrath nurse so that we were able to provide more care. And what we really would like is a dedicated metastatic breast cancer nurse down here in this region. That's something that we're trying to push for, and we would really love to see that be part of the service that we can offer down here. And they're looking at feasibility studies also of building a St John of God down in Bustleton, so that would provide that private cover down there too. I'll skip that one. And I just finished with my doggy because, just our aim is to support and provide information, reduce stress, and I think it's really important to work out what works for you to reduce your stress. So for me, it's coming home and taking my dog down to the veggie patch or the dam, and like Carrie mentioned, noticing those little things, the things that give you joy, and noticing those every day. So thanks very much. Please come and see me if you would like any details of that information, and I can email or get that to you. Thank you.
Thank you, Michelle.